Assalamu alaikum everyone. Welcome back to my channel again and happy Sunday to you all. Our today's topic is on endometriosis. Endometriosis is among the most serious conditions that affect women's health both psychologically, emotionally and psychologically, and it's a very painful condition. Now, what is this endometriosis? Endometriosis is a condition in which a tissue similar to that of the endometrial layer grows outside the uterus, grows abnormally outside the uterus, and this leads to severe pain which is unbearable. Normally, the uterus is covered by 3 layers. We have the perimetrium, which is the outer layer, and we have the myometrium, which is the middle layer or muzzle layer, and then we have the endometrial layer, which is the inner layer of the uterus. After the egg has been successfully fertilized by a sperm, the fertilized ovum will then travel through the uterus, and finally it will be situated in that endometrial layer, and the endometrial layer will keep this embryo until delivery. In the absence of fertilization, or when the egg has not been successfully fertilized by a sperm, it will shed this egg together with some debris and some blood, and then it will flow through the vagina as menstruation. So, people with endometriosis have severe pain, which is unbearable. Very severe pain. I repeat, severely, that the severity is more than expected. You cannot even imagine the pain women with endometriosis are going through. Now, signs and symptoms of this endometriosis. The first sign is severe pain. Normally, some women tend to have pain before or during their periods, dysmenorrhea, and that pain is not that severe. Some have pain like less painful period, and some have more than that. But in endometriosis, the pain is unbearable. Even painkillers, analgesic, cannot relieve this pain. Though anti-inflammatory medication sometimes tend to relieve the pain, but not that completely. We have joint pain, generalized body pain, we have generalized body weakness, we have mood swings, we have shoulder pain, muscle pain, nausea and vomiting, leg pain also, numbness in the hands or shoulders, weakness and numbness of the hands, severe bleeding, sometimes with too much clot, dark period. This dark period, like the period will not be as, the color of that period will not be as normal color of the period, like red one, like this one, or this. In endometriosis, the blood is dark in complexion because the blood is already old, it's an old blood due to retrograde menstruation. Sometimes we have a scanty or spotting in between periods. Now, what are the causes of this endometriosis? We have retrograde menstruation. Sometimes during period, when a woman is menstruating, the period will not come, like during the time of menstruation, monthly period, the woman will not have her period, and the period will stay in the endometrium, and then that period will stay, and then it will cause severity of that pain during, if the period is coming the other month. When the period is coming, it will be very painful, and it will be darker because that blood is already old. And then we have the cesarean section. During the cesarean section, if it happens to be like during cesarean section or CS, if that time there happen to be like a scar in the uterus, that one also causes endometriosis. And then miscarriage also, and then delayed period, like delayed puberty, like people who didn't start their period have late periods during adulthood, like they will take up to like 17 years without starting their period. That one also leads to endometriosis. Now, what and then infection of the uterus, like endometritis, also that one can lead to endometriosis, because there is difference between endometriosis and endometritis. Endometritis is an infection of the uterus, infection of the endometrium, and endometriosis is, in that condition, tissue similar to that of endometrium tend to grow outside uterus. Now, how to diagnose this condition? The main confirmatory diagnosis of this endometriosis is laparoscopic surgery. Laparoscopic surgery, in which the doctor will put a camera, is inserted, a small incision will be made, and then a small camera will be inserted through that opening, and they will visualize inside the uterus, and in that time they will see if there is presence of scar tissue and some adhesions inside the endometrial layer, and sometimes transvaginal scan, also some MRI. All this can diagnose if there is endometriosis or not. Now, what is the management of this endometriosis? After the confirmatory diagnosis, the doctor give some combined oral contraceptives. He will recommend, or he will prescribe, combined oral contraceptive pills like Levofem, and then they will give anti-inflammatory medication to relieve the pain, to reduce inflammation, and they relieve the pain. And they will give you there is another medication, danazole. Sometimes they will give injection, hormonal injection like Noristrate or Depo, also help in that, because that one will help in reducing the formation of adhesion and the formation of that endometriosis. So now, if you happen to see any of the following of the signs that I have mentioned, that I have already mentioned before, especially severe pain which is unbearable, kindly visit your doctor so a proper diagnosis will be made. Thank you.